Morning, everybody.
Morning.
Morning, Don.
Morning, Don.
Hey, Lois. Oh, I forgot my coffee.
Just got mine.
I don't drink coffee, so I'm not a coffee drinker. 30 years as a cop, I never drank coffee. Just ate the donuts. What's for breakfast, Don?
Apple fritter with coffee.
Oh, okay. Morning, Kathy and Chris.
Good morning. I saw Kirsten on the news last night.
Uh-oh. Yeah, I heard her. Mark Belling was using her name in vain again.
Oh, was he?
Yeah.
What
Yeah,
happened?
apparently there's they contracted with a company to enforce the standards for population within the different businesses, so capacities.
Oh, okay.
So that they can, if they violate them, it's a $5,000 fine in Milwaukee County. So I'm sure that's not Kirsten,
Yeah,
but I'm sure she's pretty much told that's what you need to do.
I'm sure.
Oh, kitty cat's coming in for the meeting
Yeah.
too. That's right. One of my huskies will probably come in here and start talking to me in the middle of the meeting too. So that's what usually happens.
They can be very vociferous, can't they? Those huskies.
Oh yeah, they start to sing, and I can close the door. It don't matter. When they howl, they're like wolves. You can hear them for like 10 miles. I don't know if everybody's on board yet. I don't see Tyler here yet. Because we have to introduce him.
Right.
I hope your shirt isn't portending the future weather, Chris, with all your snowmen on there.
Yeah, I hope so too.
Well, they said we might get some snow this weekend.
Yeah. Hopefully it does the same. I'm not going to do my driveway for sure. If it does snow.
They're supposed to get 2 feet out in Denver.
Oh my God.
Oh, okay.
I heard 4 to 5.
4 to 5 here?
No,
Really?
4 to 5 feet in
4 to 5 feet.
Evergreen,
Up-
Colorado. I got a friend that
Oh,
lives
wow.
up there.
Oh. Well, it's light snow there. It's always right.
Yeah.
Yeah.
I don't know if I should wait for Tyler to get on. Because we're at 8:31. We'll give them a couple minutes. Oh, here we go. Oh, that's Karen. Is that is Karen representing the
It's a horrible picture.
I know. It's really,
Yeah, is it foggy there?
it
yeah,
looks like it.
that's not Tyler, is it?
Is that Tyler?
On Karen Everett's
Looks
screen?
like-
You're muted.
Working through some technical issues, so give us just another few minutes.
Okay.
Last time. Thank you.
Okay, so that's Tyler.
Looks like him.
Okay.
Yes,
There he is.
it is me,
Can't
but it's
tell who he is.
we're working on that. Hold on.
We're down on the lakefront, and it's really foggy down there in Ozaki County. Uh-oh. Oh, I can see you now. Coming in
It's a
on
little better.
a little better. Okay, why don't we begin the meeting of the joint Washington Ozaki Board of Health. We begin affidavit of posting. I'm not going to read it. It is written in the on the agenda. So we will begin. We have a quorum, so we'll begin with the amended minutes of November 20th, 2020. I have a motion to accept.
So moved.
Second,
And second by
Kathy.
Kathy. Okay, any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. We have an
Any opposed?
echo going on.
Yeah, we do.
Yeah. Yeah, maybe when we get done with this, we'll mute unless we have to talk. So the minutes of January 15th, 2021. Entertain a motion to accept those.
So moved.
I have one comment on that.
Sure.
The second page, the heading indicates it's from September 18th, 2020.
Yeah, they
The
catch that.
page 2 of the minutes, which is just one sentence where you're
Oh,
adjourning the
yeah,
meeting.
I see that. That's on the header.
Yeah.
Okay. Yeah, we can fix that. That's not a major deal. So Lois, you
I'll move as amended or as with the correction.
okay, and then a second.
I'll second it.
Okay, Chris. Any discussion other than that? Okay, all those in favor signify by saying aye.
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 Any opposed? Okay, it passes. Heather Weber, welcome aboard. Great to meet you for the first time. Sooner or later, we'll probably meet in person. Would you like to give us a little update on yourself?
Yeah, I've been with the health department now about a year and a half, joined the strategist team, and in the fall became community health director, and now jumped to director. Before working here, I was in Milwaukee for 8 years with a nonprofit doing public health and community development work. I have my master's in public health from University of Minnesota, and I went to Cedarburg High School. So it's nice to
Okay,
circle all the way back here.
Short and sweet. Well, welcome aboard. We're glad to have you. And yeah, I don't know where
Thank you.
I'm getting the echo now too. I'm getting the delay. All right. So why don't we move forward to the 2020 annual report? Read through it. It's pretty extensive. Did you want to speak to that, Tyler?
Yeah. I'll jump in and I'll share some highlights overall. but you know, this can be a discussion too, and I'm sure many of you have questions about certain aspects of the report. So, you know, starting off with it being a 2020 annual report, we know 2020 was deep.
Sound's gone.
Yeah, we've lost your
You lost your
audio.
sound.
Yeah, we've lost your audio, Tyler. It's
Thank you.
intermittent when it does come in, so. I'll try it again.
Now, how's it now?
Mm. It's gone.
I could hear you when you said, could you hear me now? And it was good. Now I can't hear you at all.
How's this?
There you are.
Other thing.
Yeah, it's still intermittent, but go ahead.
Okay.
Gone.
Yeah, now we don't have any audio.
Obviously,
Now you're muted. Okay.
Oh, now we lost him.
Okay, get back. But you're still mute. You're back, but you're muted yet. So try unmuting, Tyler. Okay. No audio at all.
it's too slow.
Did anyone have any questions?
Enter your meeting ID followed by pound.
Yeah.
You entered 99131025237. This meeting ID does not exist. Please re-enter your meeting ID followed by pound. You entered 442617. This meeting ID does not exist. Please re-enter your meeting ID followed by pound.
We can hear you. We can hear your phone pretty well. Maybe you can start talking. It'll work.
We're working on it. We're trying to give you better audio. 1 minute.
Yeah. Yeah, we're hearing you now. Hopefully it stays that way.
We'll see. I don't trust the internet here, so we're trying to dial in by phone.
Yeah. You're coming in loud and clear now.
1 minute.
I think he's coming through the phone though, which would work.
Okay.
Not yet. We will be in just a second. Someone will have to let us in, but
Yeah.
okay. Well, if it's working,
Okay.
we'll see. So I'll just go with audio. Seems to work better on our end. Well, let's see. Okay. So deep challenges in 2020. In the beginning, we were planning, beginning of the year, we were planning a community health improvement plan. We had to put that completely on hold because of the pandemic. And this is something to look to in 2021. What informs a community health improvement plan is the health assessment, surveys, focus groups, data from the community with deep changes. socially and economically to our communities that moving forward, we may have to reduce some community information data gathering to build up that community health improvement plan. I think some of the challenges are highlighted in the reports, especially if you compare 2021 to 2020. I looked at both reports and pulling some data just to give you some insight. So in 2020, there were 140 Washington County and 147 in Ozaukee. And in 2020, there was only 19 in Washington County and 23 in Ozaukee. Our contact with patients dramatically reduced because of social distancing measures were needed. Environmental Health Department in 2020 responded to, sorry, I get the years wrong. In 2019, responded to 2,600 inquiries. In 2020, it was 1,800. Lead poisoning in 2019, there was over 935 different tests conducted. In 2020, 725. In Ozaukee in 2019, 950. In Ozaukee in 2020, 757. An interesting program to look at in terms of data is the WIC program. In 2019, they had 1,800 participants, and that was about the same for 2020. Well, the reason being is that the WIC program participants dropped off when in March, April, May, at the height of social distancing and lockdowns. But then the demand for WIC increased. It increased steadily, and so our WIC team is now busier than they have been and allowed to move to remote appointments. And so they're able to fill those requests, and now the demand for WIC has increased. And I think that program highlights a deeper need that we're starting to see throughout our communities, and further emphasizes the need for really a strong community health improvement forward into 2021, and just showing how the community environment has changed, and how the pandemic, the closing of businesses and people losing jobs, and the demand on families for nutritional support has increased. So there's a lot to pull and a lot to relate from the reports, but it's really important to look at in the context of kind of 2019 and 2020 and see how those numbers have changed over time. And I could go on and share more, but I also wanted to leave it open to many of you for questions and discussion, because it's really important to share that space, and just like to hear from you what you saw or thought or questions about when you're reading the report yourself.
Any questions, anybody?
I have one. And let's see, what page is this? Page 12. Under Ozaukee 2020 outcomes. The third bullet point is coordination of Ozaukee Criminal Justice Coordinating Council. How is the Board of Health involved in that?
So that's part of our strategist team. They meet to see if there's improvements with individuals within the justice system. I know the coordination happened, but the work has been put on hold. I could connect with the staff person in charge of that and get more details. That was more active in the beginning of the year than the second half. So I don't have too much detail for you on that, but I can certainly get you a short explanation.
I only asked because in Washington County, I don't believe the Department of Health is involved at all in ours. So I was curious as to what their role was.
Yeah. Yeah, we work with the justice system to help support and the coordination of that meeting, not necessarily involved in decision making. And then in Washington County, there's been starting one there, but hasn't fully taken hold. And there was, I think, a push to maybe try and, but again, the pandemic put a number of initiatives on hold.
Okay, and that I can
I
understand.
mean, a lot of our coalitions were on hold. Yeah, a lot of our coalitions were on hold for the year because the pandemic really, which I'll get into, but I want to provide some space for other aspects of the report before I dive into our COVID response of 20 pages, which is the last few pages of the report. Yeah.
Okay, thank you.
Yeah. Anyone else? So in terms of learned, jumping all the way back to page 20 and page 2021 or 21, one of the very first to implement the incident command system, and that was creating a unified structure across all departments of who was in charge of what, and so we could be mobilized before the pandemic really took root in our communities and before it could overwhelm us. And so that then enabled us to very quickly realize we need to build our capacity and build the health workforce. So we start racing. And so that was anyone who had a positive, who was positive through a test. We then had to interview and quickly who were they close to, who were they within 6 feet of for 15 minutes or longer, family members, friends, coworkers, colleagues, and then had to interview those people and advise them on what to do. And so there's a lot of uncertainty in the beginning of how COVID-19 behaved. There's constant updates from the CDC and Wisconsin Department of Health Services. And so, we hired a number of contact tracers, and over an entire 12 months, hired 50 external contact. I have 50 now. We have about 20 to 30. That was paramount to us communicating with businesses and long-term care facilities and assisted living and childcare and schools. So there was a very large team with our contracted workers as well as internally to be able to respond to the pandemic, especially to when the lockdowns happened then in May and June. There's kind of more of a trickle with those close contact cases as well as positive cases. And then it steadily grew all the way through November. And November, at the peak, we were having over 200 cases, positive cases alone per day. And we weren't able to handle those positive interviews without an extensive team of contact tracers. So building the capacity and having the flexibility to rapidly build a public health workforce within our department was critical to navigating this pandemic. There are challenges in technology, moving to the next bullet. And even most recently, this is more in 2021, but this will hold into a little bit the next bullet on the agenda, but the need for technology for contact tracing as well as sign up. Recently, it's only a few weeks ago, I think now, where we had 200 spots available. We posted a link and it was for eligible populations, so mostly 65 and older. And when that link went live, it was full within 60 seconds. So, especially when vaccine distribution first started a few weeks ago, the demand was very challenging to work through. And even then, when we first posted the link on our website, when vaccines first became available, we had 47,000 people try and log on to our website at once, and it crashed our system. So technology has been critical to trying to stay on top of the pandemic, and we've had a lot of learning throughout the time with that. CARES Act funding was critical, and it helped us with gain more technology. as well as hire our public health workforce and that team of contact tracers, as well as fund our staff time, as our staff time largely went to COVID-19 over this last year. Another piece is equity, serving those high-risk individuals, migrant farm workers, those with health conditions, long-term care facilities. So again, there's a interconnectedness of all these points where the CARES funding allowed us to increase our public health workforce, but then allowed us to better respond to long-term care facilities, assisted living, businesses, and those who are at most risk. Jumping down a little bit, and then having a nimble staff team. We have to jump into roles that they originally weren't hired for. Other duties as assigned really took hold in 2020, including myself. I'd never done contact tracing before, and then within a few weeks, a few months into the pandemic, I was managing a team of contact tracers. And so having people to respond, whether it's media inquiries, requests from businesses, individuals that are just confused and scared and not sure what to do, we needed to adapt and adapt rapidly, and we're still having to on a weekly basis. And so having staff that are nimble and ready to jump in has been critical. And then, as I shared before, our community health improvement plan, which is critical for all health departments. We'll want to focus on this in 2021 and with a fresh lens, as 2020 has changed our communities in ways that were now things are just much different than they were even 12 months ago, now that we're a year into the pandemic. So those are some important highlights I want to share about 2020, and just pause again and open up if you have two specific questions about our overall pandemic response that you've been hearing publicly and through these meetings. And
I have a question about how are we going after the homebound in the vaccination?
That's a good question. We're doing planning for that. For example, we've traditionally had, in which we did conduct a program. We're in conversations with community partners. I think a really critical piece in this homebound will be the Johnson & Johnson vaccine. So Moderna and Pfizer vaccines have very strict transportation and storage requirements, and also our 2-dose vaccines that do make getting to homes trickier and requires more coordination and consequently more staff time. And so the Johnson & Johnson has a more stable shelf life, more lax refrigeration requirements, and it's a single dose. So, we're hoping in the coming weeks to get Johnson & Johnson vaccine to really help us get out and get to those who are homebound. But in the meantime, we are planning as we speak to get to those who are homebound.
One of the things that,
Oh, go ahead.
sorry, the state now has given out about 1 million doses. Now, does that include the people that have received both doses? Or is that?
That I believe is total doses.
Okay, so.
So in our counties, for a vaccine,
Sorry, we seem to be lagging a little bit
update.
behind. We seem to be lagging a little bit behind in getting the doses that we need to provide to our citizens. So is that?
Yeah. So that's are we lagging behind in getting doses? So at this point, Ozaukee County is actually doing better than most counties in southeast Wisconsin. As of this morning, 24.2% of adults have received their first dose, and 69.1% over the age of 65 have received their first dose. In Washington County, that's a little bit lower. 18.7% of adults have received their first dose, and 63.6% of those over the age of 65 have received their first dose. However, the total count of people in Washington County is higher than Ozaki. And so those numbers are increasing every day. And we're continuing to see an increase in the amount of vaccine, I think, that's coming into our counties. Good news is our teachers, faculty for both public and private schools, I think should be done with first doses within the next 2 weeks, within the next week. And so we've been working hard with our other vaccinators in the county. So overall, I think there was concern in the beginning that we weren't getting as much as other counties, but I think that has changed. And again, the vaccine distribution is changing rapidly. If you would have told me 2 weeks ago that we'd be almost done with schools at this point, I wouldn't have believed you. And so very surprised about the amount of vaccine that is starting to come into our counties. And I think that's only going to continue to increase, especially come April when there's more Johnson & Johnson available.
Great, thank you.
That's good news. I know that you opened up the site again for the waiting list. What kind of numbers are you seeing?
I think we have, I haven't checked this morning, that list has probably over 2,000 people on it. And we've been largely been able to accommodate those who are over the age of 65. That's when you sign up, able to indicate which eligibility group they fall under. So I'm happy to say we are able to largely fulfill the 65 plus, as well as teachers and healthcare professionals sign up for that as well. And so this waiting list is also different than the link we had a few weeks ago, where if you signed on at 10 o'clock and tried to get your name, if you got on, if you didn't, and you weren't able to get your name list. And so this allows us, I think, to be more nimble in the process and potentially could provide. So I do like this process more in posting the first link. So it is not the same link we had originally posted, but there's certainly a demand for the vaccine still, and we're able to get people signed up with what we have. One potential challenge is moving forward is the more vaccine than we predicted in the county, and vaccinators are still struggle to find people that are still looking for it. Our very active vaccine, it's not easy necessarily for everyone, so we're ensuring we're trying to secure, again, our vaccine for the most vulnerable, and that's 65 plus. But as more vaccine gets out there, more we'll be looking more and more for more people to the new eligibility that opens up on March 29th, which you may or may not have heard about.
Do you think you're going to ever be able to do a mass clinic?
Again, if you would have asked me that last week, I probably would have said no. If you're now asking me this week, knowing what I'm starting to hear from the federal government as a state, that potentially we may be able to hold some mass clinics come April or potentially May. Oh, we just started to revisit that again. Again, any sign that vaccine supply was increasing until the last few days. So I remain hopeful again that we may be able to do that in the future, especially with Johnson & Johnson.
Great. Thank you.
Okay, any other questions? All right, hearing none. Why don't we move into the communicable disease update?
Yes, let me see where I put my numbers. I think, so I have, and you can see as well, comparing, I think 2020 to 2019 is also very telling. And maybe you've seen that in previous meetings and throughout the year, but for category 2 diseases in Washington County in 2020 are the and in 2019 there were 756. And that's very similar with Ozaki County. And so people were distancing from each other, masks, and so that just by nature will prevent the spread of disease. So it is just very, there has to be research done on what happened with communicable disease across the country. And then really no major concern except we are seeing a large spike in chlamydia at this time. Not too many theories as to why, but it's certainly a concern, and our CD team is watching that closely and working to rapidly handle those cases. But overall, nothing major to report beyond that within communicable disease, but I do encourage you to look at those numbers and compare 2020 to previous years because it is very telling, just another indicator of how different 2020 was versus other years.
I didn't hear you when you cut out. What is it? Was it the carbon monoxide that you're looking at?
No, yeah. That if you look, those have certainly increased.
Why is, I mean, I don't understand
2
that.
months. Yeah. I'm not entirely sure either. Carol Lee's, she might have some insight as to why.
Making sure you can hear me. Can you hear me?
Can you hear Carol Lee?
Yep, we can hear her.
Okay. The overall numbers have been increasing over the years. Some of it, especially gonorrhea, has become resistant to some antibiotics that have been used in the past. We are also seeing combined diseases, so chlamydia and gonorrhea together. We're seeing it in age. We're not sure why. We know our education process within the schools has been good, but it seems to be hitting an 18 to 25-year-old age group. Why they aren't doing the protection that we often encourage in our education process is hard to say. But the antibiotic resistance is making a difference. So as they move to change, it's not only what our people are doing out there, it's also the medical process of treating it.
Okay. Notice that I know with social distancing and the mask wearing, it's going to reduce the amount of influenza spread, but I think one case in Ozaki County, no cases in Washington County through the entire flu season is not accurate. Since probably November, at least in Washington County, prior to Thanksgiving, if you go to any bar or restaurant, the only people wearing masks are the staff and wall-to-wall people throughout, and yet seeing a steady decrease in the COVID cases and absolutely no influenza cases whatsoever.
Flu cases, did you say?
Yeah, no cases this entire flu season in Washington County, and only one in Ozaki for flu, according to the stats.
Correct.
So either we're getting misdiagnosed.
In the stats, we are the only ones we are reported are hospitalized influenza. Community, so all other age groups, we would not necessarily get those numbers. The only thing that's reported are those that go into the hospital, are tested, and come up positive. The major age group for that is usually 65 plus for the hospitalizations. because I think of the infection prevention that's being done in the long run, that is helping to reduce majorly the hospitalizations of influenza. Because overall, masking in those settings is preventing the spread. We know that for sure, because they're testing for both in those facilities. So that's my personal opinion why we do not have the spread that we would normally, or the numbers we would normally see.
Okay. Any other questions on the communicable disease report? Okay, hearing none. Let me get back to the agenda. We already did the COVID-19 update. Anything on the department update that you want to share, Tyler?
Well, I think the biggest department update is the interim director, and I've been in this role for about 4 weeks. The rest of the staff are steady, still are working with their contact tracers. And then, let's see if there's any WIC updates. There's a current expiration of May 20th. I don't know if that will be potentially renewed. We're working with seeing kind of what next steps comes up. And then our February 2020 was 1,200 people, 790 families. There's over 2,837 benefit for January 2021, total of $84 of redeemable benefits for participants. There's a 20% increase from January 2021 for the Ozaukee County WIC site and a 12% increase in the Washington County WIC site. So, and we're also working on a new WIC formula contract to change companies, and then as well as 76.3% of local WIC moms offered breast milk to their baby in 2020. So the WIC program, again, as I shared earlier, has seen a lot of changes in its programming and continue to adapt, and potentially even looking ahead with distribution plans in place of how to have WIC continue to be remote, but also with in-person options. Planning just to return to some level of normalcy with vaccines pushing through, but very happy with the WIC program staff and the changes that they've adapted to and what they're bringing to the table and moving forward.
Good.
One of the major department reports.
Okay, one other thing I wanted to ask, I was doing a little bit of figuring, and according to the burden and the amount of cases that are coming per 100,000 every 2 weeks, we're in Washington County about 11, just over 11 cases per day, and Ozaukee is right around the same, maybe a little bit lower.
Yes.
That's accurate.
About 20 cases per day in total.
Okay.
Yes.
So we should
So
be
those are
starting
good
think
numbers to
about-
see.
Right. So like we talked about in the task force meeting, we should start looking at when do we start, letting people get back to normal. So I mean, it's getting closer to that point.
And it's made closer every day, as well as with the new eligibility from DHS on March 29th, those with pre-existing medical conditions and just overall medical conditions can. And I don't have that list in front of me, but it's a long list of by people. And so it's one reason we're planning mass vaccine, because come next month, there's going to be a lot more eligible with a lot more vaccines. So that contributes to the conversation about what recommendations are out there for beginning to open. And also I heard that CDC has already potentially next week or two even more guidance for those who are vaccinated and how they can go out and interact in the world again.
Right.
So it seems the more they learn about the vaccine news there is, and the more the their current mitigation requirements for those who are fully vaccinated.
Right. Yeah, let everybody know I've gotten both my Moderna vaccinations. I'm 2 weeks out from the last one, and my arms haven't fallen off, and I didn't get sick, and everything went very well. So the fear that's out in the community is
Good.
unjustified.
Same with me.
Yeah. Good. Yeah, and the CDC shared if there's 2 people that are fully vaccinated on different households, you can hang out together without masks on. So that's good news for all of us. I'm sure there will be more information like that coming to us in the coming weeks.
Great. Awesome. Okay, any other questions before we go into the next meeting date? Okay, hearing none. When is our next meeting?
May 14th?
May 14th. Maybe not May 14th, but I think the following one we should probably be able to meet in person. It should be really nice.
That could be a real possibility.
Yep. Then I can see your smiling faces in person. I can't
And
even
I
see,
won't have my
I can't even see
snowman
Tyler's
shirt on.
smiling face
Well, if
right now.
everyone's vaccinated, we could meet together.
Right. Okay. Well, then
Yep.
we've conducted our
We
business.
don't have to be
Think it's really
Appreciate
distracting.
it. Thank you, everybody.
Oh, yeah, I hope you get your audio fixed before the
Yeah.
next
Yeah.
meeting.
Okay.
It's terrible.
We'll work on that. Maybe we'll be in.
Didn't hear
Can't hear
you.
you.
Well, again, welcome, Tyler. Thanks for doing what you're doing. You got a great team there, and we appreciate all the stuff that you guys do. So, with that, we'll call the meeting adjourned. Thanks everybody for attending.
Everyone.
You bet.
Bye bye.